Good morning, and thank you very much for joining us. I am Yori Folani. Hope we meet you well. That is, TM meets you well. And it's a particular greeting, in these times. We hope that we shall continue to meet you well as long as we abide by all the advisories and, that we are hearing. Of course, leading up, the president has said that we should not panic. And indeed, he has said encouragingly that we have it under control. Well, to the extent that anyone can have coronavirus under control, you get our meaning. But I think the message of the president is that we do not need to panic. That doesn't mean that there aren't serious issues. Now, my guest this morning, Dr. Orolua Finney, is the Senior Special Assistant to the Lagos State Governor on Health. Lagos State, of course, is an arrowhead of this war against coronavirus, as we might put it. Lagos State government, as you all know, has received high commendation in the past in, confronting, epidemics, and here we are. Thank you very much for coming on, Dr. Finney.
Thank you. Good morning.
Thank you for coming. In particular, there's so many aspects to it, and we're almost like inundated, but there's always something new. In fact, it's gotten so fast now. We hear that there's good news on the horizon in that Wuhan in China hasn't reported any new case in recent times. So the whole world is saying, wow, that's good. It must mean they're getting something right. But then when you bring it down to us, we are still experiencing escalating numbers. From just one confirmed case, then we sort of, quote unquote, managed 3 confirmed cases. Now, we were chatting before coming on here, and you said in Lagos alone now, you actually have at least 12 confirmed cases. And that's not the national figure.
No.
That's not the national figure. Now, one of the things we've been told, and we'll touch on all aspects of this, as many as we can within the program. Yesterday, I did hope that the phones would work, but if they don't, between Dr. Finney and myself, we'll try our best, to, cover as much ground as possible. But we'll just see when it comes to that time. Dr. Finney, social distancing is a big one. While the scientists are researching into it and desperately hoping that they shall come up with some sort of an antivirus, in the meantime, we've been told that, and thank God for that, soap and water is your major ally. And then we've been hearing that social distancing too. Now, we've also heard recently in our locale here that gatherings more than 50 are discouraged. Schools are closing down. People are being told to work from home as much as they can. Let's talk about that. Churches and mosques comes to mind immediately when you hear that no more than 50 people. What are the religious authorities? Are they cooperating? Are you happy that you have an ally in them, since they can speak to their members and greatly help government out?
Great, thank you. Well, social distancing comes across there are different levels to social distancing. And when this outbreak, when we had our first few cases, the level of social distancing we're advocating was in engaging with anybody at that time, whether they were ill. You stand at least 2 meters, which is 2 arm lengths away. You stretch your arm out, you double that distance, and that is how you should engage with people who are ill.
Do we have the required social distance between us?
Oh, absolutely.
We do.
With a little bit extra.
With a little bit extra.
Yes, there is a little bit extra.
2 meters, you're looking at 6 feet thereabouts.
Exactly.
Minimum of 6 feet.
I mean,
it's more,
it's
but
difficult. You can't walk around with a ruler. So the
Yes.
rule is that you stretch out your hand.
And 2 arm lengths.
And then 2 arm lengths is the minimum distance you should have between 2 people. And that was for maybe people who were sick, coughing at that time. But I think because it is evolving, as a rule now, that should be the distance between 2 people generally. Whether they are ill or not, there should be distance between them. Now, also evolving.
And sorry, before you continue, and it goes without saying, you have recommended, that is, doctors have recommended, No hugs, no handshakes.
Absolutely not.
Never
No,
mind pecking on the cheek and kissing.
Absolutely not. Absolutely. This is, I think, before I answer the question, I want to appeal to people to really understand what is going on. Over the past 2 weeks, 3 weeks, because of the situation in Europe, we've had a lot of influx of Nigerians who live and who have transacted business in those parts, returning to Nigeria before the borders in Europe were shut. Now, quite a number of them have come back. Some of them have come across people who may be ill. Three people who are in isolation right now were people who traveled and came back. They were on flights. So what we've done is to ask that people self-quarantine at home. That is another level of social distancing.
Okay.
Good. So what that means in essence is that you are in your house, you restrict yourself. It depends on the size of your house, because we also know that homes come across different sizes. But somebody traveled on a flight, so it's a certain kind of person already. So you restrict yourself to one room in the house. You're not wandering up and down the house. You restrict interactions with members of your family. Your food is brought to you and left for you. You pick up your food, you eat it. Whoever is going to handle, as much as possible, maybe if you want to use disposable plates. If you cannot, whoever is handling your crockery, your plates, must also be mindful of the fact that they are handling it. If you have waste that you've generated while you were alone in this room, you double bag it, and then it is at the end of it all, you dispose of it. Now,
this is very serious.
It is very serious.
Very, very
it is
serious.
very serious because COVID-19 is spread by droplets. It means when you talk, when you sneeze, if you put your hand in front of your mouth, you can feel the breeze. Good. That breeze is not just air. It's also coming with a bit of moisture from your saliva. And definitely when you sneeze, you see the spray. That moisture, that saliva, contains various microorganisms, and that is where the COVID-19 is found. And so it may not fall directly on the person you're talking to. It may fall on a surface, and somebody else comes, touches the surface, and then puts it on their face, which is why we're also saying keep your hands clean. Keep washing your hands. If you don't have access to water, use a hand sanitizer. Perhaps if you are in transit, use a hand sanitizer. But as much as possible, continuously wash your hands. Now, we've advised people to should self-quarantine, and I'm going to say this. The truth is that people who are flying up and down are elites. They are of a certain socioeconomic demographic. And we have seen a lot of disobedience in that. Now, the truth is this.
To the advice to
self-quarantine
once they land.
So the phone lines were filled yesterday with neighbors, with colleagues, with people at work. Oh, my colleague traveled and she's at work today. My boss traveled, he's at work today. My neighbor traveled, he has gone out. My neighbor traveled, she has gone to her shop. The phone lines were filled with all those kind of reports yesterday. Now, whatever businesses we think are urgent and we're trying to transact today, let me assure everybody that if people do not play their parts in self-quarantining, the period of people still moving around will shrink considerably. It will become an escalated response.
Yes.
A forced response that will last longer. You can imagine everybody on lockdown for 1 month. Whatever business it was you thought needed you urgently, and you couldn't stay home for 2 weeks. What happens when you're on lockdown for 1 month? And when you eventually go back, because everybody else has been on lockdown for 1 month as well, your business is not going to peak that day. So I'm appealing again to all our passengers coming in. Those who have come in over the past 13 days, those who have come in over the past 1 week, to remain at home under self-quarantine.
Could I just go over what you said, your explanation as to what self-quarantine entails? Because you have a situation where you know your house, of course, you go back to your house, it's not about remaining in your house, walking up and down,
No.
remaining in your yard.
No.
Even a couple that use the same bedroom, one of them traveled, they
Yes.
cannot, whatever, that bedroom cannot
They
take those
shouldn't.
two people
No,
anymore.
no.
Whatever is the situation, if you have a guest room, and here we don't want to sound as if we're talking about the elite alone, but the point that you are making is that there must be a separation. Even in as close a relationship as husband and wife, they cannot reside in the same room anymore.
Ideally not, except if the husband or the wife, whoever the person is that didn't travel, is willing to also be in that room for 2 weeks.
Okay, I see what you mean.
Yes.
And then you've explained that not only do they need to be in the room, they don't need to be walking around. So things as innocent as going to the fridge for a drink, no.
Except
Let it
if
be
the
brought
fridge
to
is in
you,
your room.
unless the fridge is in your
Yes.
room. And then
Yes.
you've said whatever crockery and is used, you have to be very, very careful
Very
about it.
intentional in handling it. Ideally, maybe you want to use disposables. But if not, if you are also, because for the environment, that's another case, maybe you don't want to use disposables. At the same time, your crockery must be handled carefully.
This reminds me about women and their babies and how they sterilize everything
Yes.
that will go into the baby's mouth.
Yes.
And it's almost on that level of seriousness.
Oh, definitely.
And whereas people take that for granted, that, that is the way it is, I guess what you doctors are saying is that we have in this period to come to understand that having a sterile environment as much as possible is as important.
It is. So part of what social distancing and some of the environmental cleanliness and personal hygiene things that we had and continue to advocate was that you keep your environment clean. This includes making sure your trash is well disposed of, cleaning your floors, cleaning all the surfaces in your house, including those places we forget, like your door handles. I don't know many people that clean their door handles, but this is the time because those are the places where transmission happens. You've opened the door, you sneezed onto your hand, you've opened the door. I'm coming behind you, I opened the door.
And these viruses live for how long? Because you might have sneezed into your hand and forgotten about the fact that you sneezed.
Yes.
If you sneezed an hour ago...
No, we're talking about 72 days. It's not hours.
No, I mean that the virus will remain
Yes,
alive.
yes, days.
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 If not properly handled, if
Yes.
not washed.
Yes. So, I mean, simple detergent is soap as well now for cleaning. Use your detergent. For those who want to use hypochlorite, you can use hypochlorite. And hypochlorite in simple terms is bleach. Any kind of little amount of bleach. So now I'm going to come to your question of the religious leaders.
Okay. How
led us on this
cooperative
path.
are they being?
Yes. Now, right from the beginning of the matter, we have engaged different communities, whether the market women, the local government chairmen, and of course our religious leaders of the two main faiths. About 2 weeks ago, the Ministry of Home Affairs, that is the ministry that interfaces with them, had a meeting to intimate them about what COVID-19 was and some of the social distancing methods that we had said, including the use and provision of hand sanitizers, enough water spots in church to allow, or mosque, wherever they are, to ensure people can wash their hands. Because, of course, the Islamic faith requires you to even wash prior to prayer. Anyway, so for the Christian faith,
it's just that soap is not
no
involved.
soap, yes, no soap. So we had advocated that. Now, as it evolved, because this is an evolution we are watching, there was a further meeting, I think on Wednesday this week, where we spoke about where they were engaged, same time, same ministry again, Home Affairs, asking them to limit whatever congregations they were having to 50 and below. Now, following that, some congregations, now I use congregations for the two faiths, have taken a bold step in fact, banning all physical worship, congregational worship now, whilst some others are still playing around. And I say playing around from the relatively saying that, okay, we have several rooms in our church, So when each room gets with 50 people, we'll move to the next room, which is just playing. Because remember that at the end of the service, all the 50 people are going to come out into the same compound. To the outright telling people that they should come to church on Sunday as usual.
That's what you've heard of.
Yes, we've read letters today to that effect, telling people that because they have enough hand sanitizers for the service, they should come to church as usual, which is completely against the principles of and the agreement we had with them on Wednesday. Now, I say this, let's even imagine for a fact that everybody sanitizes their hand when they're coming into church, which is highly unlikely. We know how things work. Does the hand sanitizer stop me from sneezing on you while the service is on? Because the truth is that there are also asymptomatic carriers of COVID-19 within us here now.
Asymptomatic means?
They don't have, they're not showing, they're not ill. They're not coughing, they're not sneezing,
but
they're not running a temperature.
That they don't have the virus.
They have the virus.
And can transmit it.
Oh, and can transmit it and are transmitting it. So somebody comes into church, and whether asymptomatic or not, all we do in church, no matter how the person sneezes or coughs, everybody will turn around and look at the person. Beyond that, there's not really much that can be done. But in between the service, what happens? Whilst we're in the service, people can sneeze, people can cough, people can do anything and transmit. So it is not a foolproof that you have put hand sanitizer on people's hands prior to their entry into the service or into whatever it is, does not proof anybody. And right now, the truth is that the level of social distancing we are at now has called for a shutdown of schools, has called for a shutdown of sporting events, and we have appealed that congregations should be less than 50, but I think that was on Wednesday.
That was on Wednesday.
But the picture has changed between Wednesday and today, Friday. It has even moved beyond congregation of 50. We're at the point now where there is really no need to congregate anywhere.
At all. You know, it's interesting that I'm hearing this morning, because only this morning I was reading the papers, and in particular, the Guardian ran a story about how CAN and the Supreme Council on Islamic Affairs, that they had themselves said that all their members should adhere strictly to the advisories coming from government. So I'm therefore surprised to hear that you are still getting letters of pastors, as you said, not taking it seriously enough and wanting to offer options that you say from a science basis, you're just playing. You don't understand how serious this is. So one has to be careful about the news that one is hearing. Reading this morning in the papers that they have put out the word to all their members to not congregate, that is to listen to government, listen to the officials, to you saying to me that you are actually getting letters of men of God, as we style them, saying that maybe it's not as bad as government is saying.
Now, I would also add this, that there's precedence for asking for social distance. We have seen that in countries that implemented social distance early, the number of cases and the severity of the outbreak was limited.
Yes.
Now, I want to remind everybody that even countries which we see as countries with high resource are struggling with this outbreak. How much more our countries are called resource limited? We're going to stretch, and if we stretch to a point where the system cannot cope, then everybody who is not joining hands to ensure social distancing right now, everybody will have suffered for it, and needlessly.
Now, Doctor, maybe this is where I was reading another article, and it was all about debunking some of those myths that are out there relating to coronavirus 19. Now, as you know, maybe you don't, social media is flooded with all sorts of coronavirus jokes, from the foot touching to the elbow touching in lieu of a handshake. From what you've just been explaining, that is a dangerous practice.
I think we're at the point right now. At the beginning, it was acceptable. We could still come the distance. Right now, it's time for everybody to more or less isolate themselves within their family units.
Within reason.
Yes.
Yes.
Within their family units.
Within the family unit. That
Yes.
you're talking about at home.
At home.
Now you come out to work, socials, you run into a friend, you go out to a shopping mall, and I'm going to ask what you think about shopping malls. You go to those kind of places, and people are, oh, hail fellow, well met, and they're doing the jocular foot-touching thing. Or I just wanted you to comment on that.
Okay. I want to say people should remain calm. But in remaining calm, everybody, the fight for COVID-19, the fight to rid our environment, our country, it's collective. The government cannot do it alone. We cannot. It requires everybody playing their part, from those who have traveled, self-quarantining, from the faith leaders not asking their members to congregate, to people now behaving responsibly even on social media. WhatsApp has become like a pot of beans for all sorts of misinformation. Misinformation of all sorts. And people are mischievous. They will even take the logo of a respected organization and put it on the misinformation so that people feel that, oh, this is safe. Genuine information. Number one, there are the group of people that don't think there's any COVID in Lagos or coronavirus in Lagos. Well, I want to tell them officially and once again that it is here, it is real, and from the reports that we are getting, there are more and more cases.
And so when some people also say, in line of what you're saying, when some people also say that, to the glory of God, they always precede it with that. To the glory of God, I survived Ebola in this town.
Yes.
Coronavirus is nothing.
How many cases of Ebola did we have? Altogether, I'm not sure they were up to 10. Altogether. And Ebola transmission is completely different. For Ebola, you actually have to be quite close to the person, within physical distance, to get it. Now, with this, people are sneezing and touching. It moves. The next person gets it, sneezes, touches, it moves. The mode of transmission did not allow Ebola to move at that speed.
Okay.
Now, the mode of transmission of this makes it easier. It's not airborne, but it's droplets. It's still droplets. Good. So that makes
And you said these droplets, when they land on the surface, say it again, doctor.
72 hours.
Can actually be active for 72 hours.
Yes.
And I'm happy you said you don't want to, nobody should panic. That's not what you want to do. The president has said, but I'm just thinking of rails, stair rails, banisters. And if you said, look, if somebody sneezed on their hand and then forgot about it, thought he was being safe, and then touches some railings or banisters and is gone his way,
yes.
Could he have transferred the virus to the railings, for example, and then go on his way, and the railings still take whatever is left of the 72 hours to be alive?
That is what we've said. That is what it is. That is how transmission is happening. It's like I said, it's not just me talking to you from too close.
Yes.
It is somebody sneezing on their hand, opening the door, going out. I come back a few hours, a few minutes later, I open the same door, and then I touch my nose. I hold my nose, or I pick something up and put it in my mouth with the same hand. So banisters, light switches, door handles, all tabletops, all the places where there are common movements, there are places that we should watch out for, which is why we say hand washing.
Yeah.
If you wash often, whether or not you have touched, you've removed from your hands.
Okay.
And if you cannot, use your hand sanitizer. And we're also asking, if you're coughing or sneezing, not into your hands, but if you don't have a piece of tissue or hanky handy right away, you do your elbow. You sneeze or you cough into your elbow. But as much as possible, now everybody should be moving around with a hanky, with a piece of tissue, and generally watch it. So if you're combining that with hand washing, then you have less transmission.
And then going back to the hygiene point that you made, I imagine washing, because such contaminated handkerchiefs must now be treated especially more carefully than in the past. And even as you're advising sneezing into the elbow, laundry care you know, is going to have to be more serious than before. Now, you also said, you didn't say directly, but I could infer that, look, in mopping at home, soap, water, disinfectant, you know, are those in the right order?
Hypochlorite. I didn't say disinfectant.
Okay, hypochlorite,
Bleach.
which you said is bleach.
Yes.
So it's not about Sanitas or Izal. It's about
And those
bleach.
are
I know, but I just had to say those brands because this
Those
is
are
serious,
brands.
doctor. This is serious,
Those are
doctor.
brands.
Everybody knows what those two brands
Hypochlorite.
are.
Hypochlorite.
Those two brands also fit under
No.
Uh-huh.
No.
So
no,
if a person
no.
thought they were
Those
doing
are
well,
different chemicals. They are disinfectants.
are they of
Different
any
chemicals.
effect? Are they of any effect?
I don't know. What I
Okay.
know about is hypochlorite.
Hypochlorite.
Yes.
And AKA bleaches.
Bleach. And there are different types of bleach in the market. We're not going to name any here today.
No, but bleach.
Yes,
Get hold
bleach.
of bleach and
dilute. Oh, don't start using
no, of
raw
course.
bleach.
But what you're saying is that, you know,
dilute in water and use to clean.
and used to clean.
Yes, you mop with it, can wipe surfaces with it.
Mm-hmm.
It's very simple.
But in terms of doing the washing up, the soap has already done that for you.
Soap is fine.
Soap is fine.
Yes.
Uh-huh.
Soap is fine to wash your clothes. Not all clothes can be bleached, and you really don't need to bleach your clothes.
No, you don't want to bleach your clothes.
Exactly. So what
So
you want
soap
to do
is fine.
You wash.
Yes.
If it can take it off your hands, it will take it off your clothes.
Exactly.
Yes.
And so if a person has just finished hand washing their clothes, he's good, she's good.
It's fine. It was in soap, it was in water,
Exactly.
and they're fine.
Just so long as they don't touch the doorknob as they're leaving the washroom. But you see, we're saying all of these things for people to know the unsuspecting ways in which you could, God forbid, pick up the virus. People might, as you are saying, be so sensible about it, but be totally innocent and not understand that even using the stair rail as you were going up in your office or at home, well, it wouldn't be at home because you've just told us the regimen for people who self-isolate at home and how I'm sure they will be careful. And even those that tell you that they are self-isolating, I imagine what you've just shared with us, the officials would have shared copiously with them as well. I'll take a break now, Doctor, and then we'll come back and get much more advice from you. Stay with us, please. We'll be right back. Okay, welcome back. And we've been chatting with, no, it's beyond chatting. We've been talking with Dr. Orolua Fini, who is the senior special assistant to Governor Sanwo-Olu. But I could say the senior special assistant to the governor of Lagos State on health. I don't imagine that the two of them, senior special assistants. So, okay, I redeemed myself. She's been teaching us and telling us what social distance is, what it actually means. And we're going to also address some of the rumors out there about coronavirus. But before then, as we said at the top of the program, schools are being shut down, and indeed we have a package on it.
Recovery of the first index case of coronavirus in Nigeria, there have been lots of public enlightenment. Now, the battle against the virus gets tougher. Schools in Lagos are expected to shut down academic activities from Monday, the 23rd of March, a directive issued by the Governor of Lagos, Babajide Sanwo-Olu. At most of the schools visited, pupils and students are in the middle of their second-term examinations, which will now be interrupted. Hours after the Governor of Lagos, Babajide Sanwo-Olu, announced the closure of all public and private schools in the state to prevent the spread of the pandemic, students and teachers of this private school appear set for the sudden break in their academic activities, which they have described as very timely.
I know some of our parents will be expecting it because it happened during the Ebola. And even some of them have been asking if the students will stay at home. But we think we'll be able to manage until the end of the term. But we are here, we have to move on because the government said we should shut. Right now we are having our exams, and the exams have to be stopped. But what we have done is that we had to review the timetable. We are going to print and give copies to all students, then give them a newsletter. Then immediately we are asked to come back, the exam starts all over. We'll continue with the exams.
Before now, there's been a lot of awareness on the side of the school, trying to create awareness about the coronavirus. And one of the major things we have taught them is to wash their hands as often as possible. And the school has made available junctions where students, wherever they are, they can wash their hands at interval with water, running water, and soap.
With the interruption in the academic calendar comes a note of caution to parents to keep their wards safe.
We have a very critical situation at hand, and academic activities must continue one way or another. That is why we are imploring the parents to pay more attention to their wards. We have directed the school authorities to give more homework and assignment during this period, so that the parent can, engage their wards, be with them, assist them with assignment and the homework, so that this period will be able to engage them more.
While it is not clear about resumption, residents of the state are urged to take all precautionary measures serious and stay safe. Abimbola Agbebi, TVC News, Lagos.
Okay, thank you, Abimbola, for that report that had gone out earlier. And as I said, we're speaking with Dr. Orolua Fini, and really talking about social distancing, the coronavirus and social distancing. And what I'm getting from all of this is that we're going to have to actually become very present and conscious, especially as it relates to habits that we've taken for granted. Health personnel are telling us to keep our hands away from our face as much as possible. And this is a subconscious action. People do it without even thinking about it. So back to you, Dr. Finney. There are a lot of rumors. We spoke about social media, WhatsApp, which is a brand. You talked about brands earlier, but for ease of understanding, we talked about all the jokes on there. Beyond all the jokes, which tends to make light, perhaps, of the situation, even though most people who are on social media are people of high sense, and so they know when a joke is a joke. But worse than that, misinformation. There's a lot of that out there. Would you like to speak on that?
Okay, yes. Well, I think maybe because the app we're talking about is a closed group
Yes.
app, it's difficult to know exactly
What?
what each group is up to.
Yeah.
Good, but what is also clear is that a lot of those things go round.
They do.
So eventually
It will
land on somewhere where
whether you like it or not, you're going to get it.
So let me start from the ones that say maybe garlic or ginger,
Thank you.
marijuana, drinking alcohol would keep you or protect you from the coronavirus. That is all false. Now there's one going around as well with the UNICEF, the old logo with the mother carrying her baby. That's misinformation as well. Now the next thing yesterday was chloroquine, and chloroquine has been in view for a while now, before the US finally got to it yesterday, and I think the US triggered a new wave of chloroquine rush. Coronavirus, COVID-19, is something that is new. A lot of research is still ongoing as to how to manage it. Now, some of that research included chloroquine and hydroxychloroquine. But none of it is conclusive yet. There are studies that are saying. Now, yesterday, the president of the US made some statements about chloroquine, which were immediately refuted by the FDA. Now, the FDA is our own equivalent of NAFDAC. Before you can come out and say something treats something, it has to have gone through a process. Yes, we're in a hurry, there is an emergency, but there's no point killing people who would have recovered by trying to treat them with something unsubstantiated. Now, so chloroquine is still under review. Now, let's lead to drug abuse, because this morning I've had a couple of reports from colleagues who have had people rushed in for poisoning, chloroquine poisoning, between yesterday and today, because people believe that, oh, it is a drug that they should use to treat themselves for coronavirus or prevent it.
And the chloroquine is what you refer to as OTC, over-the-counter
It
kind of a
is
drug.
an OTC.
You don't need a prescription.
You don't need a prescription. We typically were using it as an anti-malarial routinely before it. So other drugs fell into favor, and then it became like a secondary drug. But there is no drug that does not have a side effect, whether at low dose or at high dose, and continuous usage. So people are being rushed in. Families are having to seek care, not from coronavirus,
but from
chloroquine poisoning.
And chloroquine can do that to you.
Oh, yes. A series of things, including blindness, including shortness, all sorts of symptoms. And then you also don't want to damage your organs irreparably because, you know, you were trying
So
to...
being itchy all over is the least of your problems.
No, it's the least.
It's the least.
Because with that, you can do an antihistamine and be okay. But if you now take it in excess, and which people are trying to do as well, remember chloroquine has a course. If you have malaria, you treat it for maybe 3 days. Now, if you go treating chloroquine like a multivitamin, you are going to run into trouble. You want to take it every day until COVID-19 leaves the country. There will be trouble. So for now, it may change. Everything is evolving. We don't have the data to say what role chloroquine is going to play. And then some of the research was chloroquine in conjunction with another drug, not chloroquine alone. So if you're just taking chloroquine, to what end?
And it's self-medication, by the way, which
Yes.
doctors frown at, you know.
To what end? So please, I want to appeal to people to take it easy with chloroquine. What you also do is that when people need the chloroquine, they can't find it anymore.
Yeah.
So is it nice because you're trying to, or is it right? Not about niceness now. Is it right that because you're trying to prevent something you're not sure you even have, somebody should die of malaria because they cannot access chloroquine?
Which brings me to another point of people panic buying everything in sight, much more than they could conceivably need. But I've heard that this also has a negative effect because there would be people who actually really do need some of those things at the moment, as even healthcare professionals. It wouldn't be available because somebody has gone and bought up all the cartons of gloves or all the cartons of face masks that are available. So people don't buy those hand sanitizers just one or two anymore. They just say, look, how many cartons do you have? You know, that kind of a thing.
So I think, like I said earlier, collective.
We all
Everybody
need to
must play
think
their
doing.
part. If you are rushing somewhere to buy up everything, okay, that's fine. But remember that you still need to live in the society
Exactly.
you've created by creating that scarcity. If people don't have access to gloves, if they don't have access to face masks, and by the way, those things are not for general public use right now.
We've been told.
The advocacy is to wash your hands and to use your hand sanitizer, cough, hanky, or tissue, and stay 2 meters away from people when you're interacting. That is what the advocacy is.
And I think you have heard your colleagues, fellow doctors, say that the hand sanitizer thing is actually secondary to soap and water washing.
Absolutely.
It's only for when you can't get...
Which is, I also said that if you're in transit
Yes.
or something, you've been in public transport, you've come down, you're heading into your house, use your hand sanitizer. But immediately you get into your house, use your soap and water. Soap and water is superior to hand sanitizer, and that's that. But you see, people like bright lights, flashy, the more difficult things. The simplest thing is the most efficient thing. Soap and water, wash often, hand sanitizer if not available. The truth is, the research is also showing that if improper use of face masks can lead to infection.
Now, Doctor, places like shopping malls, what would be your commentary on that? And shopping malls, you take out your credit card, or is it debit card, you hand it to a person, the person touches it, needs to handle it, gives it back to you. How dangerous are shopping malls or other mass markets?
Okay. you left a step out, that the person will give you the keypad of a machine that quite a few people have also touched that day. So you punch in your pin.
Yes, and the person, nowadays they hand it to you. They hand it to you.
So you punch in your pin.
Oh dear. And so what you're going on, you probably wear one of those gloves.
So look, right now, it's time to restrict movement by yourself. The government has been escalating the restrictions in degrees. People don't need to be to panic. They need to be sensible. We've closed schools. Religious organizations have been encouraged to reduce congregations. This morning, 3 airports, international airports, were closed. That means also even as a restriction on travel for citizens of about 13, it was 5 last week, we're up to 15 or 13 right now. It's a signal. And for me, pretending that you cannot hear or that you cannot see does not take the problem away. It is time to restrict your movement. It is not time to go to the mall. Malls are places where there are a lot of people touching all sorts of surfaces. It is not time for club. It's not time for any place.
Because I was going to bring that up.
Nightclubs
have not been closed, have they?
It's not. Well, we're talking now. This is still morning.
Yeah.
A lot of things can happen.
Can still happen.
We woke up this morning to the airport closure. We woke up one morning to the restriction on travel. Things are evolving. Things are evolving.
But you said it. People have to individually be
sensible.
sensible.
Oh, yes. We must be sensible. If you go and overbuy, it's really futile. Because if you deprive people who also need, it's coming back.
Yes.
It's like you traveled and came back and you think you should move up and down. Well, it's okay for now. But if you push the system to the limit where absolute movement is restricted, which people have had to do in different countries, who would imagine that Europe would lock down? Good. So with the amount of level of resources that they have, now if you push it to the level where it's absolute restriction, then it is a loss. It is a loss.
As I want to ask another question, I'm just recalling some of the things you said. 2 arms length away in public, if that is possible.
Yes.
Which means that if you people can just, high yourselves.
No, there are also the highs.
The highs,
yes, I'm not sure about the elbow or the foot
or the
anymore.
foot thing, anymore. That was initial. The initial
Initially,
stage.
yes. Yes. So for rumors, please, we had appealed before. If you cannot verify the information, and there's a lot of information out there, the truth is that people like sensation. So they're quick to pass on a lot of these things without verification. So you can go to, if you're on Twitter, at LSMOH, that's Lagos State Ministry of Health, at Prof. Akin Abayomi, at ncdc.gov, the Nigerian NCDC, Center for Disease Control, and find up-to-date and accurate information. Of course, the international partners, their websites, the WHO, UNICEF, there's so many. There's accurate information. Please stop passing it along.
Indeed.
We don't want fear. We don't want panic, because even that will lead to loss of life. I've heard people say, I don't want to go to that Yaba place, but I'm feeling sick. Okay? You don't want to go to that Yaba place. You're feeling sick. What would you like? How does that move things forward? You're at home, or you now want to go to your private hospital and spread the virus. So ideally, if you've traveled or you've had contact with somebody who has traveled, you should self-quarantine 14 days, as we have discussed. And if in between that time, you start to feel unwell, we have various phone numbers that we've already shared. The most recent, which is 08000 Corona, 08000 Corona. Please call those lines and we'll get you. But also remember, this is a period of very high calls. Be patient.
You might not get through immediately.
You may not, but we will get to you. You will get through, we will get to you, and we will attend to you. Now, the other thing is this. I want to appeal, because over the past 48 hours as well, people have been calling those numbers prank calls. just call just for nothing.
I mean, it's
You call, you say all sorts of things that it's not that you need help. Those lines are for people who need help. Children are calling those lines. So if you have children at home, please advise. Do not test those lines. They are working. They don't need testing. They are working. Allow the lines to be free for those who need attention and will get to you.
I'm sure parents listening to this, parents can't always know what their kids are up to, but parents hearing this can probably just talk to them, tell them about it, you know, because it's important.
Sorry, the Yaba Center is comfortable. I don't know why it is in everybody's mind, and which is why the media also, they have their own responsibility in this as well. Everybody has a part to play. What is sticking in people's minds is that the Italian wanted to run away. Now, please remember that as of yesterday, our index case has been there for 3 weeks. He has not run away. He's comfortable. Everybody else in there is comfortable. The facility is comfortable.
How long are you going to keep any case for if you have to come in? How long does treatment take? And like, if you know, because I was reading something, and it's good that you are here, that he's about to be discharged.
Fantastic. So there is no fixed time. It's based on your test.
Okay.
So there are periods of testing, 72 hours, 48 hours, 24 hours. And since he has been there, 2 days ago, he had his first negative test. We've been testing him ongoing. So he had his first negative test. We require a second negative test for us to now say he's fine
clear
and he can leave. Remember that case number 2, who contracted from case number 1, had a much shorter period there. He was there for a week. So you cannot fix it and say, you only be there for a week or 2. But the truth is, it is extremely selfish to start moving around because you don't want to come to the Yaba Center. Yes, nobody wants to be out of their comfort zone, which is places you are familiar with. But you'd be treated, you'll be comfortable, you will go home and start rejoin your life.
And it's free anyway.
Completely, 100%.
It's free.
Testing and treatment are free to the patients, but of course, government is carrying the cost.
Of course.
Yes.
There's no free lunch anywhere.
No free lunch anywhere. Government is carrying the cost of treatment.
About this matter about government trying, maybe can you also say a few words about trying to contact all those that were in contact? I understand this job is getting bigger and bigger, and at the last count, there are over 100 people that you're still trying to track.
We're tracking over 1,000 people. 1,000, as of yesterday, 1,300.
That you're yet to locate?
Not that we're yet to locate, that we're following up with.
Okay.
So what happens is that a flight comes in, you have passengers from different destinations, you separate it to the countries that we're concerned about, and then you have to start following up with each of those passengers one by one every day. And at some point, you must actually following up with them by phone call, and there must be visits, because we've asked you to self-quarantine. We need to check. We need to actually see you and make sure you're okay. As you are saying on the phone. Yes, sometimes you can tell on the phone, and sometimes you can't. So there are 2 flights that we're interested in. And the first flight was a Turkish airline flight that came in on the 14th of March. And the second one came in on the 13th of March. That's Lufthansa. So Lufthansa, 13th of March, and Turkish Airline, 14th of March. All passengers, calling on all passengers on those flights to please get in touch with us on those lines. And wherever you are, even those who are not on those specific flights, if you flew into the country, please self-isolate. I keep saying it. I keep saying it. Because the truth is that if it goes beyond a certain stage, everybody will be affected, regardless of how important you think whatever it is that is taking you out of the house right now is to break your quarantine. Stay at home, find a room, be there.
For how long?
2 weeks.
14
days.
14 days.
14 days.
You have to be at home.
Yes, from the day you got out of that flight, 14 days. Remember that the more you move around, whether you are symptomatic or not, if indeed you are carrying the virus, the more people you are getting in contact with, the more places it's going to spread to. It will get to a point where it becomes...
And the asymptomatic cases that you were talking about, those cases where they're not manifesting any symptoms, you could be if you're at home for 14 days and no symptoms, manifest.
Over the 14 days.
Over the 14 days.
You
should know that.
Yes, it should leave your system.
Oh, it should leave.
Yes,
okay,
it should leave your system.
It should leave your.
Yes.
Just as a little of interest, what's responsible for that? Is it their own systems fighting off the virus?
Yes, because okay, good. Which takes me also to the clinical, what we're seeing now, because it's new. When the data first came out from China, it said older people and people with other underlying illnesses, asthmatics, diabetics, hypertensives, had a higher morbidity rate, meaning fatality. They did worse. Now, the US yesterday gave another set of data saying that people from 25 to 49 were responsible for 40% admission in needing to the level of needing admission. Now, we're not clear why that difference is showing. Societies are different. Could it be genetic? All that is still up in the air. So all those saying is a disease of older people. The data is not showing that anymore.
Okay. So
the data is not showing, that should not be comfort.
So
those saying that is not a disease of black people, apart from our index case and one other expatriate, of the 12 cases we have, they're all Nigerians. They're Nigerians, so it is not. People saying heat, it is not.
That heat works against it.
Heat works against it.
We have a tropical climate, so it makes us safer.
What we need to do is to obey all the things. Be clean, stay away from crowds, remain as much as possible indoors right now.
Okay. And but businesses are also getting in on the act. They are advising their people that can to work from home.
Yes.
Those business can. Now, final note, because we've completely run out of time now, what is the temperature for those who can take their own temperatures at which you begin to say that, okay, doctor, I registered this temperature?
37. Anything after 37, then you begin to...
So if you're up to 37, watch it. If it doesn't go to 37.1, you probably don't bother the doctor yet.
The threshold.
You're on the threshold.
Yes, but from 37 and above, then please, you need to call, you need to let us know. And please, don't come to the mainland hospital.
Okay.
Don't come there.
Don't come.
No, don't come for testing.
Okay.
Call. Why? Because there's journey between where you're coming from and the hospital.
I will get you, doctor. I'll get you.
Yes.
Thank you very, very much, Dr. Orolua Fini, Senior Special Assistant to the Lagos State Government on Health. And speaking about coronavirus and social distancing, so it's been a treasure trove of information. Thank you very much for sharing it with us.
Thank you, sir.
Okay, then. So that's our program. Please stay safe over the weekend. It goes without saying. I know you're already going to do that. And join us on Monday for the next edition. I'm Yori Folari. Have a safe weekend.